fighting a battle since October 7, a battle imposed on us. But simultaneously, people go to different battles in life. Everybody in this room goes through a battle. And sometimes those battles, when they appear in your life, you don't know how they will end. So when I was a kid, the word cancer meant death. No more. So when somebody calls the office and says, will you put my name in the Misheberach list? Misheberach list means the list where we ask God to help those people recover. My answer is always yes. But I also pray for you. And I pray for you. Because this is what we do. We pray to God, but we ask the doctors to find the inspiration to care. To give from themselves. To be at night like I know you do and think, what else can I do for that patient? What else can I tell her when she comes the next one? Oh no, maybe I will call her home and I will let her know that the test came good. So tonight is being dedicated, as you already know, to something called Pink Shabbat, awareness. And we have two of the best with us. They belong to the Memorial Health Network, talking about Dr. Natasha Rueth. She's a surgical oncologist and chief of breast cancer services at Memorial Cancer Institute. She specializes in diagnosis and treatment of patients with breast cancer. She came to our town after serving with excellence in the Alina Health Cancer Institute, Minnesota, top doctor there. Dr. Marcelo Blaya, a board-certified medical oncologist, a lead oncologist at the Memorial Cancer Institute, specialized in caring for patients with all stages of breast cancer, came to us after serving in New Orleans as a doctor, as a professor in the university. We will hear from them how much can be done and is being done in that field, and then you will be able to mingle with them in the lobby. And if you have questions, they will love to answer them. We pray for you, and we pray for you, because you give the best thing that you can give to people, which is hope, treatment, and cure. Let's welcome to our bima Drs. Rueth and Blaya.
Well, it's just more than a little intimidating to get up here and talk about cancer after such a beautiful expression of faith here. So thank you for welcoming us into your place of peace and worship. It's really, I think I speak for both of us when I say an honor to have a few minutes of your time here this evening. So we are going to just spend a little bit of time going over some facts and statistics about breast cancer, and then we'll probably just save much of our talk for the end in the back so that we can let you guide the discussion a little bit, ask some questions so that we're really talking about the things that you're most interested in hearing about tonight.
Yes. What an honor to be here tonight and to see all of you and to hear Rabbi. We are lucky to be able to reach out in tonight and continue, even though we are in November now, and November is now, we switched to blue, from pink to blue, and we have to raise awareness for men's health. We just finished October, which is Breast Cancer Awareness Month, and we can't stress how important it is, because early detection saves lives. And we'll hope to talk more about that after. We should have Octobers every month of the year when it comes to raising awareness for breast cancer.
Yeah, that's funny. We do always say breast health happens year-round, not just one month per year. But you've heard it a couple of times, and we do want to emphasize again that we are making strides in improved outcomes for patients who are diagnosed with breast cancer, and that comes from several interventions. A majority of breast cancer now is diagnosed in its early stages, and it comes with cure rates in the high 90 percentile numbers for patients who are diagnosed early. And that's why it is so important to turn pink in October, to encourage the people that we love, the women that we love, to get their annual mammograms, because a mammogram is the one thing that has been proven to reduce a woman's risk of dying of breast cancer. And so it is important to start that at age 40 for most average risk women, and that is now endorsed by the United States Preventive Services Task Force, which came out in April of this year and did endorse starting at 40. That number's even younger for some people. So if you have breast cancer in a first-degree relative diagnosed at a young age, or if you are known to carry a genetic mutation that puts you at higher risk of breast cancer, it's important to start at an even younger age, 10 years younger than your first-degree relative, so mother, sister. If they were diagnosed young, it's important to start even earlier. And then genetic testing and screening is really important as well, particularly if breast cancer runs in the family. Now, 90% of the time, bad luck. It's probably more than that, but we haven't necessarily identified the biology that leads to cancer in a majority of people, even if it does run in your family. But we do find that for all comers with breast cancer, and even more frequently in the younger population, about at least 10% of the time it can be attributed to a gene mutation. So if there are familial risk factors, it's really important to engage in high-risk programming and to speak with genetic counselors like the ones we have at Memorial Healthcare System, who can help do an individualized risk assessment with you.
One of our genetic counselors is sitting at the audience and giving her our support. That's Tammy Adar. To tag along on what Dr. Rueth is saying, I think it is an exciting time for us who treat this horrible disease, that we have so many advances on the field, and it gives a lot of hope. I know that personally speaking, my own father died of bladder cancer, and we always, as a family, the way we chose to deal with was to, number one, which I tell all my patients is, number one, you always have to remain calm. You can't let emotions run high, because you need to have your mind thinking well. You maintain faith. You surround yourself with a good team. And I think this is one of the things we offer at where we work, that we have very good access to one another, and it's very important to have a good team that is communicating well regarding the care. The care of breast cancer in 2024 is personalized. It's not a stamp, one size fits all. Each patient may have one thing or another that is more particular to that patient. That is the art in doing what we do. And I think the most important thing, as I said, as a family, we chose to, number one, remain calm, number two, to put together a good team, and number three, to remain optimistic and to always have faith in God, faith in our team, faith in the service that was going to be provided one way or another.
Absolutely. Breast cancer has become increasingly complex as we understand more and more about the disease. Now, again, fortunately for a lot of patients, it is curable, not for all, but for a lot. And so I think it is important that if you do get that phone call, that dreaded phone call, and you hear the C word, to surround yourself with people who really do focus on breast cancer treatment. There are a lot of people out there who can do surgeries on the breast. There are a lot of people out there who can give chemotherapy, but finding a team who really is passionate about it, who doesn't operate on other parts of the body, who doesn't treat the other parts of the body with chemotherapy, but really finding a highly specialized team that focuses on this, particularly in this day and age when the technology is changing so rapidly, is really important. So I think it is important to make sure that you are getting your care, should you need it, at a comprehensive breast program where you have access to clinical trials and experts in the field, so that you're getting the right treatment and doing everything you can to say, someday I had breast cancer.
Thank you so much.
Thank you. Thank you, both doctors. Thank you. In the Talmud says that you should always, by the way, you know that Jews were not allowed to live in a town where there was no hospital. This was the rabbis would demand that you go to a city where there is a hospital, and if not, build it. So we did both. No? We built hospitals and we went to hospitals. But the Talmud also says that you should have good neighbors, and you are the best neighbors. So thank you for coming. Thank you for all you do for us, and Shabbat Shalom. Please rise.